Good morning, good morning, good morning. A very, very good morning to you. It's another beautiful Tuesday here on Nigeria Health Radio, your wellness companion. And of course, you're listening to the Health Convos Show. Yes, the Health Convos Show. My name is Ogo, and I am not alone. I am here with our delectable. Let me use that one on this. What was the other one Dr. Tim used?
Let's leave that one.
Let's use that one, Adi. All right, guys. I am here with Dr. Toun Adeola. She's a medical doctor, a public health intervention specialist, and currently the head prevention and care quality improvement services of Equitable Health Access Initiative. Good morning, Dr. Toun.
Good morning.
How are you?
I'm good.
You are good. You are good.
Yeah.
I love the new look. So officially, let me welcome you to the club of those who put on glasses, of Google wearers.
You know the funny story about these glasses? When I was way younger, like grade 3, grade 4, myself and my younger brother, we used to desire to use glasses. And then when we went for eye screening and they say, all good, we would be so sad. You know, I had so much respect for people who use glasses then. In fact, my mom was so sure I was going to marry a guy with glasses.
Hey, did that happen?
It didn't happen. The guy didn't start using glasses till way many years into the marriage. So I finally find myself using glasses.
Finally, it has happened. So how is it feeling?
Well, this is day 2.
This is day 2.
It's less than 24 hours, so I'm still
trying to get used to it.
Yeah.
Well done. You're doing well. All right. So on today's Health Convo Show, our topic for discussion is diabetes. Diabetes. So World Diabetes Day is celebrated every November 14th, and the theme for this year's celebration is access to diabetes care. Diabetes has been a cause for concern all over the globe. Statistics has shown that over 537 million people are suffering from diabetes. And recently, sometime in the month of August, former Nigerian President Chief Olusegun Obasanjo revealed how he successfully managed diabetes for over 35 years. Over 35 years.
I actually read about a man.
Okay.
I think he's a chairman of people living with diabetes in Nigeria.
Okay.
And he had been living with diabetes for
50 years. I saw that.
And I think he's 87 years old or something. I tried to calculate. So he was diagnosed with diabetes in his 30s.
Wow.
And he's living for 50 years with it.
And he's 87 years old. Stories like this are really, really encouraging. Yeah. So like I said earlier on, Dr. Toun Adeola will tell us all we need to know about diabetes during this conversation. So as we kickstart, we'd like to know, what is diabetes?
Diabetes, when we hear diabetes, the first thing that comes to mind is sugar, right?
Sugar.
That's the first thing, glucose, sugar. And perhaps there's something else that should come to your mind when you hear diabetes before sugar. Maybe you should think of the pancreas. It's an organ in the body that is hidden. We rarely talk about it. I remember from biology, it has the shape of a leaf. Okay. Yeah, that's what the pancreas is. And the pancreas produces like a chemical that is called insulin. Insulin is actually what helps to drive glucose into the cells.
Okay.
So when we take some particular types of food, carbohydrates especially, they are converted to glucose in the blood. Now this glucose is needed in the cells to produce energy. It is insulin that makes that process happen for the glucose to get into the cells to make it available for use. Now when the body is not able to make insulin or cannot make good use of the insulin that it produces, then there is more sugar available in the bloodstream. Remember, this glucose is supposed to go into the cells. Now this sugar is now available in the bloodstream, and then that's what diabetes is. And it's a chronic health condition it's a long
So
time
when
disease.
when the glucose remains in the
in the
bloodstream, that is diabetes.
Yes, instead of going into
the
the cells where it will be available as energy.
Yeah. Interesting. Wow. So are there types of diabetes that exist?
Yeah. So let me say we have type 1, we have type 2, we have gestational diabetes, and then we have what we call pre-diabetes. So type 1 diabetes is an autoimmune condition. What does it mean? The body sets up an attack against the cells within it that make insulin. They are called beta cells in the pancreas. So those are the cells that produce insulin. Autoimmune is like when you are fighting yourself.
Okay.
So the body doesn't recognize those cells as part of it. And begins to fight it. Okay? And then the body is not able to produce enough insulin. Type 2 diabetes and the type 1 diabetes, I must mention, is usually starts in childhood, usually between 7 to 12 years old. Sometimes you see children as young as 4 or 5 having type 1 diabetes. Yes. But it can occur at any age.
When you hear a child has diabetes, you
usually
to wonder how.
Most times 90-something% of them have type 1 diabetes. Very rarely will you find that type 2 diabetes in children. It's usually the type 1. Yeah. Okay. And rarely will you make a first time diagnosis of type 1 diabetes in an adult. Because usually the diagnosis would have been made earlier in life. Yeah. So type 2 diabetes is one that happens when the body is not creating enough insulin to be able to keep up with the amount of sugar, okay, that is in the bloodstream. So we need sugar, okay, but if it's too high, then it can cause damage to the body. Okay. So when the body is not able to produce, is not able to meet up with the demands of the sugar in the bloodstream, maybe because the sugar is so much and then the pancreas cannot keep up. You know, it's like whenever there is sugar, there's glucose, the pancreas has to produce insulin to make sure it drives it into the cell. So sometimes when that production is way higher than, so there is a demand and there is a supply. When the demand is more than the supply, then you can find type 2 diabetes. There's what we call gestational diabetes, which is diabetes in pregnant women. Okay, when their blood glucose in their blood is high, because the woman can't produce enough insulin, and specifically in pregnancy, because there is need for more insulin in production in pregnancy because of the demands of the baby and then the placenta. So when that demand cannot be met, you can have what we call gestational diabetes. How is it different from type 2 diabetes? It's different because it's temporary. So immediately the baby is born, it is expected that the blood sugar returns to normal. Yeah. Okay. But for women who have had gestational diabetes, meaning increased sugar in pregnancy, 50 to 60% of them have the likelihood of progressing to type 2 diabetes later in life. So we tell them to watch it. Now there is the fourth category, not diabetes, we call it pre-diabetes. Okay. These are people who don't have diabetes already, but they have what we call impaired glucose intolerance, when the glucose in the sugar is higher than normal, but it is not high enough to be called diabetes. Yes, and I think that we should be more aware of pre-diabetes now than ever, because if pre-diabetes, the diagnosis of pre-diabetes is made early, it can slow the progression to diabetes in many people, because there are some interventions that can be put in place at that point when you are not yet diabetic, but you are in the pre-diabetic phase. So you can actually slow down the progression to diabetes, or you can totally alter the progression.
Wow, interesting. So diabetes, are there symptoms? Are there signs one should, watch out for? That, okay, when you're feeling like this, when this happens to you, could it be a sign of diabetes?
Okay. The signs of the symptoms of diabetes that you see in the early stage, and then there are those. I'm sure we'll talk about complications later on. So there are some things you see with complications, but other things you see, yes. For type 1 diabetes, for example, so what are the things to watch out for in a child? For example, thirst, passing urine frequently, weight loss, despite extreme hunger. So you see someone that is hungry a lot of times, is eating well, and is also losing weight. Okay, and then there could be tiredness, there could be mood swings, abdominal pain, vomiting, all kinds of skin diseases, conditions rather, poor concentration, especially in children, and poor performance in school. Type 1 diabetes, type 2 diabetes, all these other things could happen. Feeling of tiredness, thirst, frequency in using the restroom to pee, frequent infections. Yes, frequent infections. I remember some people, you could have frequent boils, repeated infections, one after the other, and then difficult and prolonged healing of infections. So when those infections also occur, when it takes a long time to heal, or poor healing of wounds, the same wound, it has not healed. This leg, this wound has not healed. This wound has not healed. In extreme cases, there could be poor sight or blurring of vision, which is why diabetes is called the silent killer, because it can be there, unnoticed, undiagnosed, and it will be destroying organs in the body. And then feeling of hunger, and then sometimes there could be weight loss, especially in type 1. Type 1 is usually associated with
weight loss,
that hunger, extreme hunger, and weight loss.
Wow. So these symptoms that you mentioned, can they also be found in pregnant women with the...
Yes.
Okay, they can also...
You can also find them in pregnant
and the what's the fourth?
Pre-diabetes.
Pre-diabetes.
Yeah. So in pre-diabetes, they may not be so pronounced.
Okay.
They may not be so pronounced. There may just be a little sign here and there, but they may not be so pronounced.
Okay. So what are the risk factors of diabetes?
Like most illnesses, chronic illnesses, those who are 40 years and above. Okay, so for every birthday, as it gets closer, 40 years or older,
okay,
when there is history of diabetes in the family, which is why when you go to the hospital and they're asking you all those questions and you're wondering, why is the doctor wasting my time? So there is history of diabetes in the family, in parents, grandparents, or in siblings. It puts you at risk. When there is high blood pressure, they usually call them the twins. Just like HIV and tuberculosis, you find diabetes and high blood pressure.
They work hand in hand.
Working together.
I see.
Yes, and then overweight, obesity, especially when most of the weight is around the waist. Yes. Those who have been diagnosed with pre-diabetes, if you give birth to a baby that is weighing more than 4 kg, so those are one of the symptoms of gestational diabetes. Okay. Sometimes when the baby has a high weight of more than 4 kilograms.
All right, Dr. Adeola, I'm sorry to cut you short. We need to go on a short musical break. When we return, we'll continue with our conversation. We're having Adekunle Gold with Ire.
I burned my bridges, so I never look back. But if I had known the life I was searching for was looking me right in the eye, oh. If I had known the life I was searching for was already my own. The grass is greener when you water the ground. That's what I found when I took the ride. I realized the mountain I've been climbing is nothing but an I didn't know I already had the answers. No, I didn't know. But if I had known, the life I was searching for was looking me right in the eye. Oh, if I had known, the life I was searching for was already my own.
Yes, that was Ire by Adekunle Gold. Welcome back to the show.
Lovely
You're
song.
still lovely song, yes, Ire Ayo. And we have Daddy Ire in the house. Our technical manager happens to be Daddy Ire. Plus today is his birthday, that's by the way. So, in case you're just joining us, you're still listening to Niger Health Radio, and this is the Health Convos show. I am Ogo, and I have with me Dr. Toun Adeola. We've been talking about diabetes, which is the topic for today. November 14th, every year, is celebrated as World Diabetes Day. That is why we have chosen to talk about diabetes, which is also known as the silent killer. Before we went on the musical break, Dr. Adeola told us a lot about diabetes. She made us understand what diabetes is, and then she mentioned the types of diabetes, which she said we have type 1, which happens to children, type 2, which happens to adults, then the gestational, which happens to pregnant women, and then the last one is pre-diabetes, which cannot really be called diabetes. And back to our conversation, back to the topic diabetes, we would like to know, we've heard a lot, you've told us about the symptoms, thirst, frequent visit to the restroom to pass out urine, weight loss, especially in type 1 diabetes and all of that. Can diabetes be permanently cured? Permanently?
Okay, so I need to be careful with this answer, because my first answer would be no. Okay. I would say no first, because anybody that is being diagnosed with diabetes will need to manage the condition for life. But let me just say that in like 5% of people, they can get to a phase of what we call remission, meaning that the condition is so well controlled.
Awesome.
Okay, and then the frequency of using medications is reduced, or they are able to keep their blood sugar under control with stringent lifestyle modifications and all.
Fantastic.
So, but cure, it's a condition you continue to
manage. Yeah, because most people who have been living with diabetes, they always use the word managed. Chief Olusegun Obasanjo said he has managed it for 35 years, and the other man you talked about said he has managed it for 50 years.
When you talk about cure, you're saying that I can do as if I never had this thing, and nothing will go wrong, which is why we say there is no cure. So even if your blood sugar is well controlled and you are not on medication, which is rare, you can't just live anyhow. You will still need to manage how you live your life, the things you do. If not, it will come back.
So for this management of diabetes, what are the treatments?
So the first time someone is diagnosed with diabetes, the first thing that is usually discussed is actually lifestyle modification.
Lifestyle modification.
So that's the first thing. What are the modifications you can make in your lifestyle? What do you do? How many hours do you spend sitting? how frequently do you move around?
Okay.
So if you have a sedentary lifestyle, spend most of, like they say now, sitting is the new smoking. So sitting can kill you almost as fast as smoking will over some years. So lifestyle modification, which includes moving, less alcohol, and then of course diet, very important. People talk about diet a lot in diabetes, but it's not the only lifestyle modification that it's important. Like I said, movement is very, very important. Yes, and if you are watching your diet and you are not moving, you will not achieve the kind of results you will have achieved if you are moving and you are also watching your diet. So diet modification too is very important. And there's this popular belief that once you are diabetic, you can't take carbohydrates again. It's also not true.
Okay.
It's just that you have to take it in moderate proportions. Yeah, you have to watch your portions, especially for carbohydrates. And people also don't know that many of the meals we take have carbohydrates. It's just that some have higher percentage than others. So protein, beans, for example, is protein, but it has carbohydrates. It's just that the percentage of carbohydrates in protein is not as high as you would find in rice, for example. Yeah. So there are many things playing around our food. The glycemic index of our meals too. What does that mean? How much sugar does your body produce after taking a meal? So there are some meals when you take them, your body produces a lot of sugar, and so it makes a lot of demand on insulin after taking them. And then there are some meals like oat porridge. You take them, the glycemic index is low, meaning that the sugar is released over a long period of time in small doses. So the demand for insulin when you take such meals is lower. Yeah. So diet is about so many things. So lifestyle modification. Second thing is, of course, there are medications that can be taken. Some of them are tablets and some of them are injectables. So for many people, when the tablets don't work again, then you have to go to injectables. And some people have to actually inject themselves with insulin.
Yes, I hear that a lot.
Especially for type 1 diabetes, where the problem is that there is no insulin. It's not a case of, the sugar is too much. It's a case of, even if that child doesn't take any glucose at all, the body will still not be able to cope. So for such people, they may now need to be on, and insulin can only be taken as injectables. So there are injectables available in the management of diabetes as well. And these things have actually helped to improve the life of those who have been diagnosed. So it's not, all hope is not lost at all.
Yes, with stories coming from the likes of President Obasanjo, 35 years, and the other man, 50 years. It shows that diabetes is not a death sentence if you manage it properly, if you stick to your medications, and then, of course, lifestyle modification, as Dr. Adeola has told us. Trust me, you will just live your life to the fullest. No fear of anything that diabetes will cut your life short. Now, what are the complications that could arise from diabetes?
So diabetes is one disease that goes round. It goes round almost all the organs in the body. It gets to the eyes. It could cause blurred vision. It could cause visual loss. So it could lead to blindness. It goes to the kidneys. It could cause infections. It could cause kidney failure. It goes to the feet. So for the feet, you could, we talk about diabetic foot a lot. So there could be what we call neuropathy, and there could also be vascular disease. Neuropathy means damage to the nerves. Vascular disease means damage to the blood vessels. So neuropathy is when there is damage to the nerves. What do our nerves do? They help us to feel. So such people don't feel. And the pain you feel when you touch something else is a protection for you. So when those nerves are dead, people step on injurious objects. They get injuries. They don't know. They can't feel it until it's really bad. And then blood vessels actually supply our bodies to help the healing process. When there is also vascular damage to the blood vessels, healing is also slower. So that's what diabetes does to the feet. Infections in different parts of the body, the bladder, the kidney, the mouth, the teeth, the gums. It could cause decreased vaginal lubrication in women. So let's talk about women. What does diabetes do in women? Decreased vaginal lubrication, oral contraceptives. Yes, they can be used. They are safe, but they may slightly increase the blood glucose. And also some intrauterine device for contraception, IUD. Yeah, women with diabetes may not be able to use them because they are more predisposed to infections. And I must say that in men, diabetes could cause impotence. And then, of course, there are complications to the heart and blood vessels. You could have high blood pressure and all the attendant complications.
That's a whole lot.
Yeah.
That's a whole lot. But I mean, it's really good that we're having this conversation because people get to understand what diabetes is all about now. They have a better understanding on how to go about it and how to manage the situation.
Exactly.
Peradventure, they find out that they are diabetic.
So 2 things. First off, don't be afraid to get screened. I mean, when the opportunity comes, get screened. I mean, and there are a lot of. And I remember last week Friday, I just saw my husband, and I asked, what happened? He said, "Oh, we went to the bank, and there was this organization conducting screening." I said, "I trust you. You did it." He said, "You know me now. You did." Of course, it was good. So opportunities to get screened.
Go ahead.
Yeah, make the best of it. In case there's something wrong, you can start with lifestyle modifications early before it kills silently, like we call it.
It kills silently. Thank you so much, Dr. Adeola. Thank you so much. And then, of course, to our viewers and our listeners, we also say thank you for watching, and thank you for staying tuned on Niger Health Radio, your wellness companion. This is the Health Convo Show. I am Ogo. I'll be signing out right now. Thank you. Enjoy the rest of your day and stay tuned for more interesting content on Niger Health Radio. Bye.
Bye.